You're welcome back to the Gavel. The National Assembly passed some key bills in 2014. Two notable ones are the National Health Bill and the Pension Reform Bill. In December 2014, President Jonathan signed the National Health Bill into law. Under the Act, there is provision for free basic healthcare services for children under the age of 5, pregnant women, the elderly, and persons with disabilities in the country. Now let's go back to an interview with the Chairman, Senate Committee on Health, Senator Ifeanyi Okowa, who gave us details about areas covered by the bill.
Actually, it's a bill that establishes a framework for regulation of health and the management of the healthcare sector. It also has sections that deal with the development of the healthcare sector. And to a very large extent, it's all encompassing because it's apart from bringing forth a legislation that helps us to regulate the healthcare industry the more. You also find that we have a provision for the basic healthcare development fund, which is very key in this nation because we need to develop the primary healthcare industry of this nation. And at the moment, that is essentially with the local government councils. And we know that more than 80 to 85% of Nigerians actually have their first primary access to primary health care when they fall ill, and even for issues concerning health education and preventive medicine. It is at the level of the primary health care. And because of the paucity of funds at that level, we find that we have not actually been able to develop our primary healthcare sector the way it should be. So there is a 1% fund, a minimum of 1% fund from the consolidated revenue of the Federation that is provided for in that legislation. And we further provided for the states and the local governments to have a counterpart funding so that the pool of funds will be used for the development of primary health care. And this development is divided in various phases. 50% of the fund will be utilized by the National Health Insurance Scheme for the purpose of provision of health policies for the vulnerable, the pregnant women, children under 5, the physically challenged, the elderly, and to some other extent, other Nigerians. We hope that it could extend into the unemployed. But this is to the extent that the pool of funds can actually carry us. And then the other 50% will be spent on development of infrastructure. Part of that money, 10%, will be for development of manpower, which is very critical. Because the manpower we have at that level, we need to constantly develop them, retrain them, so that they're able to provide effective and efficient services at the primary healthcare level. And once we're able to ensure that we have appropriate equipment, we have the right medication, we have vaccines at that level, and then the staff are being motivated through a retraining program, you'll find that efficiency at the primary healthcare level will be heightened. And once we have an improved efficiency at that level, we'll be responding to so many Nigerians, because at that's where Nigerians actually, that's their easiest access. You can have in a whole local government just one secondary healthcare facility. In some privileged ones, you may have 2. But in most cases, the primary healthcare facilities are such that they are far-flung. You may have up to 2 in an electoral ward. And therefore, that is the aspect of healthcare we need to get to. Because once you take care of illness at that level, only fewer cases will progress to secondary healthcare level or to tertiary healthcare level. And if you're able to deal with the issues of preventive medicine and health education at that level also, you'll find that you'll be preventing a lot of diseases.
Now, Nigeria has a huge problem in terms of maternal mortality rate. We've been ranked as one of the countries with the highest maternal mortality rates in the world. What parts of this bill, which aspects of this bill would address this issue?
The issue is this. If you're going to have a reduced maternal mortality rate, the best thing to do is to ensure a development of the primary healthcare sector, because most of the women who are going to, during delivery, is something that starts off in a few hours. The woman falls into labor. But before the woman falls into labor, you have to have the regular antenatal care. And therefore, their first port of call is always the primary healthcare center or the nursing home. And this is the aspect that we think we don't have enough funding at the moment. We don't have a regular retraining program for the staff there. We don't have the appropriate equipment. Because appropriate equipment means being able to manage the woman while before, that is the prenatal period, and during the natal period, during delivery. It's important that the people are able to manage them. And it's also important that the people are able to know the cases that cannot be managed so that you have an efficient referral process, being able to identify the difficult cases and then being able to send them out at the appropriate time. That is part of training. And that's why, why we believe that the Basic Healthcare Development Fund, as provided for, and all of the things that are in that clause, will definitely help to improve on the maternal health care. Once we get that right, you'll find that the number of women who actually will access a skilled healthcare delivery will rise up astronomically. Because most times now, because these centers are not properly equipped, there's no incentive because there's no retraining program. So there's inefficiency of the staff that man these areas. You also have poor medication. You have very poor infrastructure in many of these primary health care centers. So people are not encouraged to go there. Rather, they go to the traditional birth attendants. You find that only about 40%, probably between 40 and 45% of Nigerian women actually access skilled delivery, and which should not be so.
The National Assembly also passed the Pension Reform Bill, and President Jonathan signed it into law in July 2014. We sat down with one of the major actors that worked for the passage of the bill, Senator Aloysius Etok, to learn more about the bill.
The major reforms that we'll have in the new Pension Reform Act will be the situation where all the pensions and pension offices have been brought under one umbrella and one supervision and one superintendency. In that case, it means that the new law captures what we call the old pension scheme, which they used to call pay as you go, through the establishment of PITA Department, Pension Transition Administration Department, to cater for pension offices like the civil service pension, the police, the immigration, prisons, what they call SIPO, and other pension offices. They're all brought together under PITAD and then put under the supervisory authority of PENCOM. That is to say, we can now have all the pension offices in the country, except maybe that of the military and the intelligence sector, put under the same administration, the same superintendency of the particular agency. And that helps us to now have a complete overlook and have a complete oversight of the entire pension offices under one administration, and to protect the funds, the pension funds, from being misapplied, misused, and to be embezzled.
Now, this agency you're talking about, PITAD, is it a brand new agency or is it an existing agency?
It is an agency which has already been formed and is existent now. They have been in existence for the past maybe 7-8 months. It is based on the report of the pension probe we did, and we recommended that as soon as, or as far as those pension offices are still scattered. You'll be having too many people looking at them. And the one who is supervisor would now be tired of trying to run right, left, and center and forward. That the best thing is to bring all of them under the same administration, as it is enshrined in the Constitution of the Federal Republic of Nigeria. And that brought about the creation of PITAD. And PITAD has now taken up, presently is domiciled in the, as an independent unit in the Ministry of Finance, being supervised by Ministry of Finance, but it has supervisory or oversights and what we call control, is under the control and supervisory authority of PENCOM.
Now this is where we draw the curtains for this week's edition of the Gavel. But before we go, let's take a look at some of the emails and messages on Facebook which we received during the week on the review of the National Assembly in 2014. Now, the first email is from Gift Orupe, and he says, I think the legislative arm has been fair enough in discharging their duties, and this is largely due to opposition party having almost the same numerical strength as the ruling party. Finally, we'll want to know what has been delaying the passage of the Petroleum Industry Bill. Another mail is from Udeme Desmond, and it says he rated the National Assembly as being poor. The next email is from edumchuku@gmail.com, and he says infrastructure is still an issue in Nigeria. The National Assembly should pay more attention to the performance level of projects approved by them, a situation where key contracts are awarded without strong emphasis on timelines is just unacceptable. The eternal construction of Enugu-Port Harcourt Expressway, especially the Abia State axis, is a case in point. That's from edumchuku@gmail.com. We have another one from Dr. Alayemi S.A., and it says, the National Assembly members have often allowed their selfish interest to override national interest. Finally, we have an email from Ovat Innocent, and it says, I think the 7th National Assembly has tried, especially the Senate, for maintaining stability in the polity, except for the House of Representatives, for their fighting all the time. Thank you for all the emails we received, and do keep them coming. Once again, this is where we draw the curtains for this week's edition of The Gavel. If you have any views or opinions, please email us on thegavel@channelstv.com. Thank you for staying with us, and see you again next week.